heard, we know that women and men differ substantially in various domains, including physical and psychological development, interpersonal interaction styles, exposure to violence and significant life events, particularly in childhood, experience of bias and discrimination, and opportunities and social roles in adulthood. I think where we need to go at this point is to have or develop a much more sophisticated and nuanced understanding of how these basic fundamental differences affect, number one, criminal behavior, and number two, resistance. Before we go on, I also think that it's very important to acknowledge the intersection of race, ethnicity, and gender. We know that for women who are white, there are certain expectations and certain beliefs about why white women become involved in justice settings. We have very different views, and I would suggest that we tend, as a society, to blame women of color for what happens to them in the justice system. And I think if we fail to address the issues of race and ethnicity in this system, we're doing a great disservice and reducing our ability to have positive outcomes. Secondly, I also agree with Barbara that gender is a construct and it varies considerably. And we also need to start thinking about women having various gender identities as well. So we need to start thinking about the effect of being lesbian or bisexual, certainly in the context of general prisons, to consider the issues of transgendered individuals as well. And also to acknowledge that part of the reason why we see the disparate rates of male and female involvement at all levels of the justice system, whether it's juvenile justice, whether it's courts, policing, corrections, has a lot more to do with the system's behavior rather than the individual behavior. So I think there are three questions when you think about the relationship between gender and evidence-based practice. The first question, and this goes back to having a more nuanced understanding of the role of gender, is there a basic difference in overall criminal risk? The second question is, are there differences between males and females, boys and girls, women and men, in static and dynamic factors? In general, at baseline, do they differ? Thirdly, are there differences in these individual factors on recidivism or any other outcome of choice, and the salience or the power of those items in predicting those outcomes? Now, I'm using an example, and I want to be clear that this is the data I'm going to talk about is used just as an example to get you to think about how this might play out in any individual system, whether it's adult corrections, whether it's probation, parole, or whether it's on the juvenile justice side. In the early 2000s, we conducted a small evaluation for New York State or their Office of Family and Children's Services, looking at the effectiveness of a systems integration strategy that was based in a diversion program. It involved many counties in New York State. It is a specialty sample. It looked at kids who had mental health and or substance use disorders and how they could divert them out of the system. And we had a sample size of a little over 2,000 kids. So the first question is yes and no. Now again, this is just an example. Girls in the sample represented only 28%. So clearly the front door of this was very different. Girls are less likely to hit the juvenile justice system, or in this particular case, the diversion program, than boys are. However, the backdoor in this particular case was the same, that girls and boys had equivalent rearrest rates at about 14%. So the first thing is that girls present different risks than boys in terms of getting involved, but equivalent risks as they depart from the system. The second question, do girls and boys differ? This is the basis upon which we usually construct our rationale for the need for gender-specific programs for boys and for girls separately. In this particular study, we found that girls were more likely to be white, boys African American or Latino. Girls were more likely to commit property crimes, boys were more likely to commit drug-related crimes. Girls had fewer prior arrests, they were older at first arrest, they tended to be diagnosed with adjustment disorders and depressive disorders, while boys were more likely to be diagnosed with behavioral or substance use disorders. Girls used marijuana less, they had more suicide attempts and more evidence of childhood abuse. That being said, those are the differences, but there are also substantial similarities in this population of boys and girls. They were similar in age, they were similar in their probability or their rate of use of weapons in the commission of a crime. They had similar rates of prior detentions, prior psychiatric evaluations, their use of alcohol or other drugs, and most importantly, they had similarities in many childhood stressors. That is, in the ones that were measured here, change in parental relationship, death of family members or friends, a family member who had been formerly incarcerated, had an addiction or had a mental health problem, and they're having been placed out of home at some point. The importance of that last piece is that this is the fundamental area that we talk about, that girls differ from boys, that they differ in their childhood stressors, and therefore this starts the pathway difference. Okay, so that's just difference at baseline. And the question is, if girls and boys differ in these different domains, do those same domains predict different risks for rearrest? And at the bivariate level, this is what it looks like. If a girl had a prior arrest, she was more likely to be rearrested. Prior detention, prior psych evaluation. If she had a behavioral disorder, if she had a history of substance use, used marijuana, or was placed out of home at some prior point. Those were all risk factors for girls to be rearrested. For boys, some of those things are similar, the prior arrest, prior detention, history of substance use, and uses marijuana. But for boys, the more important issue at the bivariate level was their crime type. And that was if they were more likely to have committed a property crime rather than a violent crime, a drug-related crime, or some other type of offense. Also notable are the absence of risk factors that are present for girls that are not present for boys, including the mental health stuff and the stressor of being out of home. When you take this to a multivariate analysis, the important thing, number one, is when you do the total, put the whole sample together, you come up with this, that gender matters, that boys are more likely to recidivate, to be rearrested than girls, controlling for all of those other things. Remember when I started this conversation about this study, that girls and boys had equal recidivism rates. When you take all of these other things into consideration, then boys do have higher risk of being rearrested. But look at the differences in the models. The things that predict in a multivariate way girls' likelihood of rearrest are personal stressors, change in a parental relationship, and prior mental health treatment, prior psychiatric evaluation. For boys, it comes down to age and prior arrest. So if you think about assessment and what are the risk factors associated with boys and girls, if you separate the genders, you may in fact come up with a very different set of predictive variables than you would if you were to just know that there was a common set and that boys and girls differ. So let's take that. That's an example. So why does gender matter? We know, number one, that women and girls present an overall lower risk of criminal behavior. We know that men and women, girls and boys differ, including their rates of exposure to early childhood abuse and other negative events. So we know that girls have higher rates of many different problems. Women have higher rates of many different problems than their male counterparts. Thus, women and girls often have a greater number collectively of health, behavioral health, and other social needs. And these are not necessarily criminogenic, but we know that these are very costly for systems. That one girl, one woman can take up a lot more resources than 10 or 100 men. This little tiny study that I showed you indicates that risk factors for women and men may differ depending on the population. More importantly, and as this confirms what Barbara was saying earlier, that pathways into criminal behavior may differ. And more importantly, pathways out may differ. We also are in a state where we have very few evidence-based programs designed specifically for women. Again, we often have programs that are adapted from male or generic models, but not very many that are designed on and for women. This leads to one primary statement, and that is we really need to understand the micro-mechanisms that operate in women's change. How do they, in fact, become prosocial citizens after being involved in the justice system? So I'm going to give you a little factoid as I'm wrapping up here. This comes out of the psychotherapy literature, but it's something that is cited by the European evidence-based practices people. And this is a meta-analysis of different types of psychotherapy modalities. And what they found was that 40% of success, of positive outcomes, is due to individual level factors. Those are things that are not consistently measured across studies or idiosyncratic or attributed to just variance in individuals, variability in individuals. 30% is due solely to the therapeutic relationship. 15% is due solely to the belief that change can happen, an expectancy effect or a placebo effect, and 15% to the modality. So here we are in a system, typically, where we throw away the 40% of the resiliencies and strengths that an individual brings with her into the system for her own well-being and her own healing. We don't hire people who have excellent therapeutic skills, so we throw away 30%. We don't really often believe that change is possible, so we throw away the hope aspect of this. And we rely on the 15% of our evidence-based programs to affect the change. So we're basically throwing away 85% of our resources and relying on a modality to do the work.
Go back to that.
Oh dear. You want to? I got it right here. You can have the piece of paper. Honest. I can even give you the citation for the evidence-based piece. I know. So let me give you something to think about as I conclude here. I was a co-PI on on a study that looked at the effectiveness of comprehensive integrated services for women who were diagnosed with mental health and substance use disorders and had histories of violence. Needless to say, lots of those women also had criminal histories. So I want to tell you about Karen. Karen came to us we partnered women from the community who met the requirements for involvement in the study to partner with professionals in all of our activities. So I ran the research component, the evaluation component, and Karen was one of the community volunteers who would be trained in conducting evaluation. Karen came in and sat down, and she introduced herself as, "Hi, I'm Karen, and I'm schizophrenic." And she looked like a schizophrenic. She looked like an outpatient. She was kind of disheveled. She was a little puffy from the meds. Her clothing was awkward. She was awkward in her personal style. 6 months later, while working with us, she would introduce herself in public as saying, "Hi, I'm Karen, and I'm a survivor." And already her demeanor was changing, her interpersonal style was changing. 3 years later, she was our representative at our federal steering committee, and she would introduce herself as, "Hi, I'm Karen, and I'm the lead ethnographer for our site." And in 3 years, this woman had transformed herself from a schizophrenic to a researcher. Did that mean that her schizophrenia was gone? No, she was still on meds, she was still seeing a psychiatrist. But the salience of that diagnosis to her identity was diminished, so that it had very little impact on her day-to-day life. And out of that study and collective narratives, this is what we understood about how women heal. For those of you who go back to psychology in the 1960s, you'll see Maslow's hierarchy of needs embedded in this. But really, what I want you to focus in on is this. This 3 pieces was what we realized, and we actually did a qualitative study, was the key to identity transformation, how people could shed negative identities and assume positive social roles. One was that they knew and began to identify with some valued role, whether it was researcher, whether it was mother, whether it was student, whether it was a peer leader, and that they had the skills necessary to act in that role. The thing that happened after that was what we call recontextualization, but what that means is that this woman looked back on her life and her life narrative and understood herself to be very different. She attributed blame in a different way. From instead of holding herself to blame, she appropriately blamed those who hurt her as a child. She understood that she was valued and that she could, in fact, succeed in life. So I want you to think about that if you could step this into a justice setting, that the same principles of identity transformation still operate. And if you look at this model, as Barbara referred to, the relational model, is embedded in women interacting with women interacting with their social network in a way that reaffirms a new identity. So implications for practice. First, I think one of the things that we need to do is integrate our understanding of the micro-mechanisms of change into manualized programs and larger systems interventions. I think Ed Latessa did a great job yesterday in his discussion of his intervention that showed how things can change at a micro level. Secondly, work with what is most important to women. build off of the therapeutic relationships, the relationship that you develop with individual women as they're coming through the justice system, build their social networks, build skills, and enhance their ability to see themselves in a different way through change in how they think about themselves. I think we need to integrate treatment services into this process and ensure comprehensive support and continuity across systems for an individual woman. Wrap those services systems around her with support through the mechanism of a relationship. And then finally, the biggest problem I see for us in the future is to establish evidence in emerging programs. We're up against a huge wall. There's a whole set of published evidence-based programs that receive funding. If you don't have an evidence-based program, it's very hard to get funding to see if it works. But that's what we need to do. We need to start trying things out and then testing them carefully with the best research we possibly can to establish research evidence in these types of programs. That's it. Thank you.